there in the comments what in the live chat what we're going to be talking about today. So we're going to do the our regular Social Security and Medicare question answers in case anybody has any questions out there. But I also want to talk about one of the frequent questions I receive is about working. I'm not going to talk about working while disabled because that's a whole different ball of wax. Let's talk about working and receiving Social Security, retirement benefits, spouse benefits, survivor benefits, all the rest of it. So let's talk about that. But before, a few announcements. It's close to the end of March, and this is the open enrollment period. So from January 1st until March 31st, you can switch Medicare Advantage plans. So if you got one last year, you don't like it, you can switch those. You can switch your Part D. You can pick a Medicare supplement plan, switch to a Medicare supplement plan. That's what seems to be a lot of people doing. There's a mass exodus out of Medicare Advantage, and Medicare supplement's kind of hard to get into if you're not 65. So I put the phone number. I've got a Medicare team that can help you with that. So just call that number. Just leave a message in your name and your state and your phone number, and they'll get back to you and see what's available. Again, that's a cutoff of March 31st. And then I got a lot of emails and messages. People want to help out, get the message out there. There's a lot of so-called Social Security experts that don't really know what they're talking about and don't give the full information and misleading, incomplete, and all the rest of it. So that's one of the reasons I came out of retirement, to try to give people the complete, full, accurate information. But it's difficult to to get out there. There's 70 million people on Social Security benefits. And so there's millions and millions of people out there that we need to reach out to make sure they're getting the correct benefits, the correct amount. This year, more people turn 65 than any time in U.S. history. So a year and a few months. Go back to my original ones I did last year. They're just so embarrassing. The camera work, all my videos are terrible. I'm trying to get the information out there. But the number one remark I get is, why didn't somebody tell me that last year? Why didn't somebody tell me that 10 years ago? Why didn't someone tell me that before I filed? So we got to get the word out there. So a lot of people emailed me and messaged me and said, what can I do? So we're going to put together a tentative name, the Community Corps. Being an old Marine Corps sergeant, I had to throw Corps in there. So a community corps. So if you want to help get the word out there, send me an email. I put my email at the top of the chat there. So send me an email and tell me you want to help out, and basically your name and what city and state you're in. And we're going to do all kinds of things, reach out to senior centers, share on your Facebook, call your local, state, federal, city politicians, call the news channels, anything you can do. We're going to brainstorm and see what we can do as a community corps, tentative name, to kind of get the word out there. So people will stop saying, why didn't someone tell me that, last year, whatever the case may be. Once Social Security answers their phones and, gives correct answers 100% of the time, then I can go back into retirement and we can go on with our lives. But until that happens, yeah. And that's another thing, the Community Corps, we're gonna advocate for better service at your local Social Security offices. So again, email me at ed@mygovexpert.com and tell me you want to join, and we'll probably do a Zoom call sometime in the next week as soon as we get some interest. and we'll come up with a plan of attack and see what kind of ideas y'all have, and we'll play around with the ideas and we'll go for it. Okay. All right. So there's that. And I'm still working on, I'm still keeping an eye on the new policy from Social Security about overpayment. So again, there's 2 million people with overpayments out there. A lot of them probably don't know there's going to be changes coming down, and we really need to get the word out there for those people. And, we're going to help them interpret the policy. All right, so let's talk about working. Go ahead and if you have questions about, again, Social Security, Medicare, and all the rest of it, number one, please press like. Everybody press like right now. Bunch of times, whatever. I don't know how many times you can do it, but press like, and that way this goes out to more people. All right, so, and then go ahead, if you have questions, go ahead and type them in the chat there. And then once I finish talking about working, then I'll start answering all your questions as usual. All right, this is not a regularly scheduled one. My regularly scheduled is on Thursday, but got a lot of information out there. So much stuff. Okay, so working. So obviously when I talk about working, I'm talking about working under your full retirement age, because once you hit your full retirement age, whatever it is, 66 and 8 months or 10 months or 67 or whatever the case may be, you can make $1 million a month and it doesn't matter anymore. So we're just talking about, if you're a survivor collecting Social Security survivor benefits, you can start, collecting at 60, up until 66, 67. So we're talking about that time frame. Again, not talking about disability. I'll do another video on that later. All right. So for this year, 2024, if you're under that, then you can make $22,320. Every $2 you go over that, the Social Security holds back $1. Okay. And people ask, okay, how do they know? Well, you tell them, or if you don't, then the IRS tells them next year, and then they look back and say, hey, you made $10,000 more last year than you didn't tell us, and therefore now you owe us $5,000. So what they'll do is they'll send you the bill, and you either pay it, or you come up with a payment plan, or they'll withhold your benefits, or whatever the case may be. They don't net or gross. That is for, your wages. So yeah, whatever you take out for retirement plans and all that kind of stuff, it's how much you actually get paid. And $22,320, if you are self-employed, it's your net income. So, a lot of people, they make $100,000, in sales, but their overhead is $99,000, so that's only $1,000. So, all right, and then the year you turn your full retirement age, that year you can earn up to $59,520. Anything over that, they hold back $1 for every $3 you go over. Okay, and again, the month you hit your full retirement age, you can make $1 billion. And if you're making $1 billion, make sure you click and buy me a coffee. All right, one of the things that again, taking hundreds of thousands of retirement applications when I worked at the Social Security Administration, I saw a lot of people around me not doing the correct things. That's why when I became manager, I did tons of training. But when you first file for retirement benefits, you don't have the annual, you have a monthly earnings limit. And that's what, 1870, yeah, $22,320 divided by 12. So you have a monthly. So if you start your benefits in July, from January until June, it doesn't matter. However much you make, again, you can make $1 million for those 6 months, but starting when you start collecting your benefits in July, even though your check comes in August, if you're starting in July, starting July, you have to stay under that monthly limit for the rest of the year. And then the next year, then you have to stay under the yearly limit, okay? Question there, at 67, 59,000 or January? Well, it depends. If you turn 67 in February, then you can earn $59,000, 559, 520 in January. So it's only the months before you turn your full retirement age. Okay. All right. So one of the problems people have is when they first file, they tell the claim specialist at Social Security, it says, hey, I'm still working, I'm making, $10,000 a month right now or whatever. But when I start collecting Social Security benefits, I'm going to go to part-time and I'm only going to make, 1,800. And then what the Social Security employee is supposed to do, they're supposed to put it in MCS, which is the computer system, and they put on this, they put in non-service months. Okay, starting in July, non-service month, and just put a little X there. But what happens sometimes is they don't do it right, and then you get a bill the next year that says, okay, you made $10,000 over, and you say, no, I made the $10,000 over before I started receiving Social Security benefits, but once I started, I stayed under. The problem is the employee did it wrong. It's kind of a convoluted system, but anyway, so all you have to do is take your proofs down there and say, hey, here's the proof that I made it before I started, retirement, and then they'll go ahead and fix it and delete the overpayment and all the rest of that stuff. So that's pretty easy to get fixed. All right, another question people ask is, okay, if I continue to work while I'm receiving benefits and I, don't go over, will that increase my Social Security benefits? Maybe. Again, Social Security determines how much you make by your high 35 years of earnings. A lot of people say, well, I thought it was your last year, the last 3 years, the last 5 years. No, it's your highest 35 years of earnings, right? So again, essentially adjusted for kind of an inflation wage index. So, that $20,000 you made when you're 21 years old might actually be more than, if you made $50,000 last year, because it's, indexed. So your high 35 years. And if you're currently collecting Social Security benefits and you work, and if that's one of your high 35 years, then it does increase your benefit amount, and that's automatic. You don't have to do anything. As soon as you file your taxes, you tell the IRS tells Social Security. It's an automatic calculation. We used to do them manually. It was crazy. Not because we needed to do it manually, because they're trying to work the system. But anyway, in terms of getting work credit so we get more staff. But anyway, that's a complicated issue. But yeah, it's automatic. But if it's not one of your high 35 years, then it won't really affect, and you'll say, where's that money go to? Well, that's where the social, I guess, in the Social Security part comes in, right? All right. And let's see what else. Another common question I get about this is, okay, if you call Social Security and say, okay, next year I'm going to go over $10,000 over, what they'll do is they'll withhold checks. So if you're going to go $10,000 over, that means you owe $5,000. You won't get $5,000. If your check is $1,000, then they'll withhold the first $5,000. But they don't hold partial checks. So if your check is $900 or something, they won't hold back, partial 1 month. They'll hold it. If you go over $1, they'll hold that whole check. And what happens is, if you get some of your checks withheld because you go over, no problem. It's not an issue at all. Just have to make sure you notify Social Security and deal with all that. But if you go over and that check was withheld, once you turn your full retirement age, those months will be added back in the sense of, if you took your benefit 20 months early, and therefore you get a 20-month reduction, but it turns out later you worked and you got 5 months withheld, you technically only got 15 months taken early. You only took it 15 months early. That won't be added back in until you hit your full retirement age. When it's all said and done, and Social Security looks back and say, okay, over the last 4 years, this person took their benefit 48 months early, but 8 of those months the check was withheld, so we're going to throw the $8 or excuse me, the 8 months back in there to the calculation. So technically, you only took it 40 months early. So, what else? Common question is what counts as earnings? Obviously, earned wages, your pensions and 401ks and IRA withdrawals and all that kind of stuff. That doesn't count as earnings. I did a video on gambling. People ask me about gambling. Does gambling count? If you're a professional gambler. If you're a professional gambler and that's your job, yes, it does count. But if you just, win a scratch or something, if you sell your house, that doesn't count. Unless you're a real estate agent and that's your job is to, flip houses or something like that, then it's your kind of your job, and so that's your business. One thing a lot of people, I'll throw this not relevant to kind of what we're talking about, but a lot of people are surprised when they, because Part B, everybody pays about $170 or so for Part B. But if you earn more, there's an extra premium. And that more is like 2 years ago. So if you sold your house 2 years ago, don't be surprised if you're on Medicare and you're paying for B, that your Part B premium doubles. And you're like, why did my Part B premium double or triple? Well, 2 years ago you sold your house, and Social Security counts that as income. They don't count it for work for, what we were just talking about, but they do count it for a Part B premium. Congress didn't set out a they didn't carve that out of. So yeah, don't be surprised of your extra premium. All right, I think that is it. So yeah, I just wanted to talk about working while receiving benefits. I think I've answered all of the calculation, all the questions I get about that. Let's see what else here. Thank you for coming out of retirement to help the community. Please remind everyone to keep copies of all documentation and notations about date, time, name of they speak to at Social Security. Yes, absolutely. Anytime you hand in documentation, hand them the document. Usually if you hand them the original Social Security, they make a copy of it and then they'll return your original to you. You cannot provide copies. They have to make the copy. And then, they can, stamp a copy and, whatever, give it to you to confirm. All right. Mom and Deb, I started Social Security retirement benefits on January 1st, 2024 at the age of 63. I'm working part-time. Am I at earnings limit yearly this year or monthly? So you started January 1st. Yeah, so it's the whole year. So yeah, you started January 1st, so you have to stay under the $22,320 this year. So if you would have started your benefits in February, then whatever you made in January wasn't relevant. Elizabeth, my husband will be 65 in August. I don't know anything about Medicaid. How do I? So yeah, you're probably talking about Medicare. So yeah, watch my videos. But you're 65 in August, so you still got a lot of time. But what is this? March, April or so. So yeah, watch my videos on Medicare and then call my Medicare team. I put the phone number up on the top of the chat there, and they can help y'all find a plan. I always recommend Medicare supplement plans myself if it's in your budget, but there's two different routes you can go. So watch my videos and get prepared and then call my team. Disney Val at 6759 or January. So yeah, I think I answered that one. I'm going through the questions. So TIZ. So if you're at FRA and work, do you have to file your Social Security earnings along with your W-2 employment? Yeah, you still have to do everything as normal in terms of taxes. FICA taxes are still withheld and all that. You'll pay FICA taxes forever. Again, even if it doesn't increase your benefit amount. So. Joe, if the year or years I worked while getting Social Security is greater than at least one of the past 35 years, when will Social Security make the adjustment? As soon as they're notified of how much you made. So as soon as the IRS, you notify the IRS and the IRS notifies Social Security, then everything is automatic. Usually it takes a little time. Good question. I forgot to add this. Usually it takes a little time because you don't do your taxes maybe until April. and then it goes to the IRS, and the IRS computer system talks to Social Security. So, the recalculation, if it's one of your high 35 years, won't happen until maybe May or something. And then, but what will happen is says, okay, well, this was a high 35 years. This is going to increase this person's benefit by, $4 a month. Hey, $4 is $4. They won't start it in May. They'll start it in January because it was for the previous year. So they'll give you the extra $4 for January, February, March, April. And, so in May, you'll get a check for 4 times $4. So it's all automatic. You don't have to do anything. Hey, sweet bug. If Social Security told you that your lifetime is $2 million, what will be the monthly payment? And will that be probably if your lifetime is $2 million? Oh, what you paid into the system? Yeah, that's I'll have to. I think I did a. Well, I'm after I finish the disability series, the video series. I'm going to do one on retirement, early retirement, and delayed retirement, all that kind of good stuff, and then I'll do the kind of the calculations. Then they do it by your average index monthly earnings, and then they give you these bend points, 90% and 30. Yeah, it's fun. Let's see. Brown girlism. How much can I make this year if I reach full retirement age in January of this year? Then, yeah, you can, you full retirement age, and yeah, so you're good. You're 100% good. You can make $1 million, and click on the thanks down below and buy me a beer. Mike, helping a widow with a qualifying child. She is receiving mother's benefit. Do the same rules about earnings apply? She will be making them up. If she's receiving a mother's benefit, so you're probably talking about the auxiliary or the surviving child in care. Yes, please, everybody click like, so this goes out to everybody. And don't forget, if you want to be part of the community team to get the word out there, whatever you can do, we'll talk about it. Just email me, and at the email at the top, and we'll do a Zoom all together. You don't need to be on camera if you don't want to. It's no big deal. And then we'll come up with the game plan to see what we can do to help out your community and your city and your state and your county and your country. And yeah, so this is your chance to get involved and help people. Okay, so I'm sorry, Mike. So you're probably talking about either auxiliary child in care or surviving child in care, where the mother, the child is under 16 years old or became disabled before the age of 22. So the child is receiving benefits. The mother is has that child in care, so the earnings limit applies. Super long story short. So she's making 45, so she's going to have an overpayment because when you're receiving those benefits, it's the intent of those benefits is you've got a child under 16 or a disabled child, and so the mother or the father, the parent, has to stay home and take care of that child. So that's where that money comes in. That's why they're giving out that money. But if the parent is, kind of not really home taking care, and that's what the money is kind of for there. So if she's out there working, then she'll be overpaid. Disney Val, if I work 1 year more to age 68 in July, it's my birthday, will I get the entire 8%? Yeah, if you, it's 8% for the entire 12-month period. Yeah, anything over your full retirement age, every 12 months, you get that 8%. But it's not, it's, even if you do it like a month early or something like that, it's just, 8% divided by 12. So if you only do, 11 months, then it's what, 7% and some change. So, but still, every month you wait, it goes up. So, yeah, that's part of the video I'm going to do on retirement, about, if you're going to take early retirement or whatever the case may be, here are some things you need to think about. So again, I've done this a few 100,000 times when so. Mama Dad, thank you for answering. Now I know I have the correct answer. Much appreciated. Yeah, you're welcome. Welcome. Make sure you press like. Let's see. Hey, Mike. Hey, Michael Burrows. How's the new job? Minnie. Let's see here. I'm on Canadian Ontario Disability Support Program. It's the provincial program, state program, just here to listen and get inspiration. Okay, yeah, my family's originally from Canada, Kitchener, up north there in Ontario. Okay, and Nature Trail. Hey, hey, how you doing today? All right, let's see here. Hey, Disney Val, appreciate it. Thank you. All right, I got my coffee mug. Um, da, da, da. Let's see. What legal action can you take if Social Security number takes a haircut? The Social Security number. Oh, probably Social Security Administration haircut. Is that a hair joke? Yeah, you're probably talking about if they project in the next 10 years that they're going to cut benefits by 30% or something like that. Could you legal action? Yeah, yeah. I don't. Yeah, I mean, you can sue. You can sue anybody for anything. So there's that. But if you're super that interested in making sure Social Security sticks around and customer service is improved and politician support, then you need to join our community core. Make sure you email me your name, what city and state you live in, and we'll get together over the next week or 10 days, and we'll come up with a game plan to improve customer service and help people. All right. All right, let's see here. I'm also doing TikTok. I never get any questions on TikTok. I don't know. I think TikTok hates me, but I keep trying. So Chinese are spying on me, whatever the case may be. So, all right, let's see here. What else do we have? Not many questions today. Everybody press like. And all right, so yeah, the new overpayment policy, we're not exactly sure what's going on. I checked this morning, and the Commissioner of Social Security has not come out with the new policy on overpayment. So we're waiting. 2 million people are waiting on that information. So hopefully it comes out soon. All right. So any other questions on all things retirement, Medicare? Like I said, the open enrollment period ends here in a few days, March 31st. So unless you have some type of special enrollment period, like you moved, or if you're receiving, Medicaid, if you're receiving Medicaid and Medicare, which millions of people are, then they have special enrollment periods. They can essentially change their Medicare Advantage plan like every 3 months. So if if you don't like the one you got, you're losing your doctors, whatever the case may be, make sure you call the number at the top, and my Medicare team can help you out. Marcia, can you explain what overpayment means? Yeah, basically, if you owe the Social Security money, so if the Social Security Administration overpaid you in the sense of you're receiving Social Security retirement benefits, and then you worked, but you forgot to notify Social Security, and therefore they're going to hold back $1 for every $2 you go over, and then they send you this nasty gram, and they say, hey, we gave you too much money, so you owe us that money back. Or on disability, same type of thing. If you work, whatever the case may be, or someone gets the complete wrong benefit. I can tell you millions of stories of overpayments, some very interesting ones. I'll make this one short. Had this lady had 2 kids, and her husband disappeared, and then it was discovered that he had passed away overseas. So they got the death certificate and everything, went on with their lives for the next 10 years. The children got surviving child benefits for 10 years. And then, guess what? The guy appears. He pops up on the radar working at a casino somewhere. And So therefore, the children should have never received those surviving child benefits because the guy wasn't dead. So that goes into the whole thing. Was that a plan thing? Did that guy says, well, I can't afford to, pay alimony or child support, so I'll pretend like I'm dead and you go collect. And so you never know whether they were in cahoots. But yeah, so um, Marshall, my husband works and I'm on SSDI. Yeah, so if you're on SSDI, the um, the working thing I was just talking about, that's more for retirement, survivor benefits, spousal benefits. SSDI, that's a completely different animal in terms of working. You have the SGA, substantial gainful activity, and you have a trial work periods and all that kind of stuff. And make sure that you watch my yeah, sorry, Michael, but yeah, we're gonna put you on timeout there. All right, so yeah, watch my videos on disability. I did 2 of the videos. I'll probably have another one up today or tomorrow on more parts of disability. So yeah, it's going to be a 7-part series on disability. Okay. TIZ, I have both Medicaid and Medicare. My renewal for Medicaid is May this year, so can I get supplement plan after it expires? It really depends on your state. In terms of supplement, you can get a Medicare Advantage pretty much anytime. A Medicare supplement like the Plan G or the Plan N, it really depends on your particular state and how old you are. If you're losing Medicaid, that might give you a special enrollment period. So yeah, call my Medicare team. Like I said, if they don't pick up, just leave your your phone number, name, and your state, and they'll call you back. And then tell them that you're interested in a Medicare, kicking around a Medicare supplement. They'll look at the laws in your particular state, and they'll see if they're able to get you something. So. Hello from Delaware. Hey, what's up? Okay, Marcia got an overpayment notice. Okay, yeah, Marcia, make sure, yeah, you subscribe. Hopefully everybody subscribes, everybody likes, everybody press like, please. This way it goes out to more people. If you got an overpayment, I don't know if you heard that there's new laws, new policy, new procedures coming down. So I'm going to watch those and we'll guide you through the entire thing. Brown girlism. Can a blind person on appeal an overpayment that was made with a person was on SSDI? It was $26,000 overpayment. Yeah, it doesn't matter if the disability. Yeah, you can appeal any overpayment. I just did a quick little one of those short videos yesterday about what a lot of people don't know is in policy, the Social Security policy, which is over 20,000 pages. Yes, I've read it all. For 20 years. But in policy, it says, even if it's not an active overpayment, that means, you just got it or you're currently repaying it. Even if you paid it off, you're done last month or last year, you can still request a waiver. So a lot of people don't know that. But, you can do that, or you can wait for this new big thing that the Commission of Social Security is coming out with, because there was there was a news channel article about it. There was the Anderson Cooper story, which I made a video about. So yeah, Social Security really needs to look at the overpayment program. Yeah, I when I worked for Social Security, I processed and adjudicated and made decisions on, thousands and thousands of overpayments. And yeah, sometimes your hands are tied. I was like, man, I would really like to waive this overpayment, but the policy says you couldn't. And if people always say, well, you should have done the right thing and just waived it if you really felt that hard. Well, if I would have waived it, or anybody incorrectly, then the next person will go back there and they would correct it And then the person was like, oh, okay, I don't have to pay for it. Yay, I'll go out and, buy a new car. And then it turns out a month later that, they overturn it and you just might be fired. So I liked eating, so, and paying the rent and all that kind of stuff. KJ, I just found your channel and so grateful since I have many questions. We'll send you an email later. For now, subscribe. Yeah, unfortunately, I get hundreds of emails and messages. That's why I do these lives. Yeah. Let's see, Mike, I'm helping a DAC recipient who is now a dual Medicare Medicaid enrollee, Pennsylvania resident. Our one benefit expert said that he does not need an Advantage or supplement plan, but I have doubt. Yeah, you don't need it. But some of them do have extra benefits, and a lot of them are zero premium. So you have Medicare. If the individual has like home health care, there's a lot of agents and brokers out there will still trying to sell a plan. I prefer not to, because if you have like home health where someone comes out to that person's house and takes care of it, cleans it, takes care of whatever, quite often those services like to bill Medicaid directly. They get paid more and they get paid faster and quicker. Same thing. So the Medicare Advantage ones, they avoid working for Medicare Advantage because they don't get paid as much, and it's a kind of a nightmare, a lot of hoops to jump through. So those, I personally, but there's usually a lot of extra benefits in there. So yeah, call my Medicare team and they'll give you your options, and no pressure. They just tell you what's available out there, and then you make your own decision. Let's see, Disneyville, Tixom in Florida. My 100-year-old mom has original Medicare AARP supplement and a state Medicaid long-term health. Wow, great job. I like, AARP supplement, beautiful thing. Yeah, United Healthcare AARP supplement, one of the biggest companies. What, 25% of people pick AARP Medicare supplements. In Social Security, used to, your mom probably, we used to send out it's called centenarians, the Centenarian Project for Social Security. We used to have someone in our office that would type up a nice little, kind of a little certificate thing, 100 years old, congratulations. And they used to go out to people's house and give them the little certificate from Social Security, congratulations on turning 100 years. It was kind of a nice gesture, and it was also, it was one of those things where Social Security had to go out there and confirm the person was, actually alive, because, once a year, the employee in our office would go out to somebody's house and they've been deceased for a couple, 3 years, but the kids have been collecting Social Security benefits. So it was a nice gesture, and it also, kind of reduced fraud. So, but I think they stopped that. So I'm sure your mother probably didn't get it. I don't think they do those anymore. Let's see. I know based on Social Security account, I will probably not be able to renew Medicaid based on, so that's part of the Medicaid unwinding, where, during Corona, COVID, they stopped kind of doing renewals, but last year the federal government said, okay, go ahead, start doing recertifications again. So millions of people are getting kicked off of Medicaid. So that's another thing that we need to go out there. People are losing their Medicaid. We have to make sure they get other options and get other coverage, because just Medicare alone, that's one of the reasons I put together this Medicare team, because just Medicare alone, A and B, is not enough. Doesn't have prescription drugs. Part B only covers 80%, so you're on the hook for the other 20%, and that's unlimited. So if you go in, get $1 million Band-Aid, then you have to pay out $200,000. So that's why you got to get something. Again, I recommend a Medicare supplement if it's in your budget. If not, then a Medicare Advantage. But budget is, I know the reality. If you get sick, sometimes it's cheaper to have paid a monthly premium for a supplement. But yeah, watch my videos on that and you'll know exactly my personal opinions. I'm never short of personal opinions. How are you still sane? Let me ask my wife. She'll say, "What? Sane?" After working all those years. Yeah, I was also a professor at the university, I still am. I just finished grading papers, midterm exams yesterday. I teach 3 classes. I think that's one of the things that kept me sane is, I did all the bureaucratic stuff. I had the third busiest office in the country. And then I would go to the university and teach class. And I was like hanging around a bunch of young people and talking and having fun. It was awesome. So yeah, I'm really enjoying this actually. I mean, yeah, I never thought I'd, be a YouTuber and do all this crazy stuff, but I'm actually having a ball doing this. So I love helping people out. So I'm going to keep doing this for another 10 or 20 years if you all have me. So, and yeah, let's put this community core together. I definitely need help. Yeah. So we'll come up with a game plan. TI, there are vehicles like income trust accounts, depends on the state, might have to see a lawyer, Medicaid, third-party company. Yeah, yes. Yeah, so that's a question about Medicaid and, people that have houses, the state Medicaids. It depends on the particular state. If you are on Medicaid and they put you in some type of long care term facility, it depends, long-term care or something like that, and the state pays for it. And then when you pass away, which we all will, the state could actually come after your house. So a lot of people don't realize that. And so there are, yes, as Disney Val points out, there are vehicles. There's a 5-year look back rule. So whatever you do has to be 5 years prior to your inevitable demise. So yeah, I'm actually putting together a team of estate planning people throughout the country. I'm trying to fill all the holes because, again, working for Social Security Administration, retirement is awesome, survivor benefits are awesome, disability benefits are awesome, Medicare is awesome, but they are all very, very limited. They need to get better, but they're very, very limited. They're only, part. So I've seen all the other things out there, all the other private programs that fill in those financial and coverage gaps. So based on my decades of experience, I kind of know, okay, people actually need to, consider this, whether you do it or not, it's up to you. But you really need to consider this, you need to consider this other thing. So I'm trying to put all those teams together under one roof to have kind of a one-stop resource. And that way, you could, get all the information. Again, whatever you decide to do is completely up to you. So, but at least you've got the information. Elizabeth, I paid for private health insurance through Obamacare. Oh, okay. Yeah. Oh, okay. I think you missed your previous question. Receiving child in care, Social Security child is on Badger Care. I am not. What's the best way for us forward? How does health insurance work? Yeah, that's if you are approaching your 65th birthday, then you can technically continue to receive Obamacare, Affordable Care Act, Marketplace Insurance. It's all the same thing. You can technically continue to receive it. However, you'll lose all your subsidies and cost sharing. So that's why most people switch to Medicare. And if you don't switch to Medicare, then you'll have a penalty, a Part B penalty and a Part D penalty. So even if you have private health insurance through Obamacare, when you turn 65, I would highly recommend you switch to Medicare. And then again, Medicare is awesome, but there's a lot of gaps in there. So you need to see whether you want to do an Advantage plan or a supplement plan, and then you need to find a Part D plan and all the rest of that kind of stuff. So again, call my team and they'll walk you through the entire process. Disney Val was able to get some 100 birthday cards from presidents and former presidents. Nothing from Social Security. Yeah. That's actually it's pretty good. It's I did that one time for my wife. I requested, I was actually from the president's wife, and sent a nice picture, and I gave it to her as her birthday or anniversary or something. Um, Joe, for MedSup, is the MedSup premium paid in addition to the Part B premium? Yes. Um, so there's Medicare, the Medicare supplement. There's 10 plans. It's number letters A, B, G. But the ones that are almost 99% of people take right now are either G or an N. And watch my videos on those. But yeah, you pay the Part B premium, 170 and some change, and you'll also have to pay the Medicare supplement. Again, this is a Medicare supplement, also called a Medigap. The Medicare Advantage, those are different. Some of those have zero premium, whatever. But there's compare the two. But you'll need a Medicare. If you go the Medicare supplement route, you'll get Part A, Part B, and then you get Medicare supplement, either the G or the N, and you'll also need a Part D, a prescription drug plan. And those aren't that bad. There's one that are like zero premium, 50-cent premium, dollar premium and stuff. So those you have. Once you get a Medicare supplement, most people stay on those, forever. Unless you move, or you want to check and see if you can get a better price on a Medicare supplement. And again, call my team if you don't already have a Medicare broker that you know and trust. Call my team and they'll go over everything. Bridget, why does Social Security take money from you if you don't keep your A and B current? Because it's an insurance. It's like car insurance. Why does car insurance company take money from me even though I haven't been in an accident in the last 50 years? Because it's insurance. It's a social insurance. Yeah. So same thing on so the people that need to go to the doctor and have hospital and stuff like that, it's a pooled risk. So the idea is everybody at 65, unless you have health insurance from work, then you don't have to sign up for Part A or Part B. Once you stop receiving health insurance from current work, then you have to sign up for Part A, Part B to avoid those those penalties. So yeah, but yeah, so it's if everybody just said, okay, I'm not going to sign up for Part B because I don't want to pay the the monthly premium. I'll just sign up for it when I get sick and I need it. Then Medicare, the Medicare would go broke tomorrow, basically. Yeah. So, and we don't want that. It's been around since 1965. Yeah. Please, everybody, press like. Let's see here. Going through TikTok here. Yeah. Don't know. Yeah. Anyway. Does Medicare Part A cost? Most times, no. If you paid into Social Security FICA taxes for at least 10 years, then Medicare Part A is free. If you didn't pay, then yeah, that it does cost like $400 something a month or something. But yeah, if you worked in the United States and paid at least 40 quarters, 10 years, then yeah, it's free. Part B isn't, but Part A is. Which plan is better, Advantage or Supplement? Better. It's I prefer Supplement. But again, if your budget, and again, when I say budget, I mean immediate budget. What I see happening is this one of the regrets, that I hear all the time is people say, well, I signed up for a zero premium Medicare Advantage plan because it's zero premium. And, being young, 65 years old, you're indestructible like you were when you're 20. And I'm healthy. I don't need, to spend all this money. And then life is life, life is what happens when you're making other plans, right? And then the next year, 2 years later, then something terrible happens. And then guess what? You'll need tons of, medical coverage in the hospital or whatever the case may be, accident or get sick or whatever the case may be. And then, it just, wow, it's a good thing I paid that monthly, premium. Sure, it was $100 a month or whatever it is in your particular state for your particular, plan you pick. But it might save you money over your entire life, even though there's a monthly premium versus the zero. But, if you get your zero premium and you live the next 50 years and you never get sick and there's no issues and, you're just, colds and break a leg or something like that, then yeah, Medicare Advantage was the way to go. And if you can tell me which future belongs to you, then I would like to know what future belongs to me as well. So yeah, you never know. You never know. Bridget, is there a way to get it back, the portion they take? Let me see, was that part of a previous question? Why does the Social Security take money from you if you don't keep your Part A? Oh, is there a way to get it back from the portion they take? Yeah, I'm not sure exactly. Were you not supposed to sign up for Part B and you did accidentally? Yeah, I'm not sure. All right, Sweetbug, if a person works and wants their own Social Security and not the company insurance, do they still have to take the company advantage? Yeah, a lot of companies out there are starting to do, they say, hey, we're going to give you all these great, perks and stuff when you retire. We'll give you a pension. And then, the CEO raids the pension plan and that disappears. Hear it every day. And they say, we're going to give you, health insurance, once you turn 65, we'll pay for your health insurance. But then they sign you up for Medicare Advantage, which costs them zero. And they're like, hey, aren't we awesome? We gave you this insurance plan, and it's, aren't we awesome? Aren't we an awesome company? Yeah, it costs you zero. I could have got that myself. So yeah, it really depends what Advantage plan they pick. So if the company is, paying for something and giving extra benefits, then yeah, you just need to compare apples with apples. Yeah. And then, look out what's in the market. Again, if you don't have a broker, an agent that you, and the difference between a broker and an agent, again, some people use these interchangeably. So there is what's called a captive agent, that's, XYZ Medicare plan company. And they're agents for XYZ. So if you call that person, guess what company they're going to recommend? It's like the old Henry Ford, you can have any color car you want as long as it's black. So if you call this captive agent of this company, they're going to say, yeah, well, this is, I have this or this other thing, which is, all the same company. But a broker, which is the only people I deal with, a broker works for you. And they go out into the market in your area and they look through all the dozens and dozens of companies and all the dozens and dozens, some places having like 20 or 30 or 40 different plans. And some people, and they look for a plan for you and they give you recommendations. Okay, out of all the plans in your particular area that covers your doctors and your prescriptions, here's one or two that maybe you should consider. And what a lot of people don't realize is that, people say, I did a video on this, and they say, well, I've got X and Y and Z company, I really like it, and I've had that same plan for, for 2 or 3 or 4 years. What a lot of people don't realize is those companies update those plans every year. You get this annual notice of change every September, and they update this every year, but they come out with new plans. So that same exact company you have the plan from 2 or 3 years ago, and it's okay, you kind of like it until, you find out, that you actually get sick and you're okay, wait a second, I thought it took care of that. Well, it did, but then they change it. But the same company comes out with a new plan that's even better. It's got better prices and better coverage and more benefits and stuff like that. And so you keep the same company, same doctors, same prescriptions, but you get more benefits and stuff. So if you want to kick around that, again, call my Medicare team at the phone number, leave a message, and they'll call you back and they'll see if your current plan is the best one. If it is, then kick it around in October when the new plans for next year come out. If it's not the best plan, then again, March 31st is the kind of the deadline-ish. Um, yes, it is being recorded. Yes, this is being recorded. It'll be, yep, it'll be posted up almost immediately. Tina, glad I found your video. Not sure if this is related, but did I hear you say FICA is Medicare? Yes, yes. So FICA, when you pay FICA, you pay uh, is it 6.2% of Social Security, and then the other 1.45 goes to Medicare, and then your employer pays a matching. So altogether, yeah. So FICA is Social Security and Medicare all together. Yep. Bridget, I was in the hospital and it was time to recertification, so I couldn't do it, get it done. Yeah, so it sounds like, yeah, that's, yeah, if you know you have any type of recertification, you know, Social Security recertification, Medicaid or recertification, SSI, whatever the case may be, and you miss it because of something like that. Again, I work for the Department of Social Services welfare before I work for Social Security. You know, there's, you know, exceptions to exceptions, exceptions. You just, you know, tell them, hey, you know, I was in a hospital and so I didn't do it. And they'll, you know, it's a kind of a good cause decision they'll make. Shamberry, how can someone get Medicaid and Medicare at the same time? Easy. Yeah, there's millions and millions of people uh, that have Medicare and Medicaid. Basically, so you have one. Let's say you have Medicare first, and then your low income resources. Medicaid is, you know, kind of a needs based program. So you contact your Medicaid office in your state. This is a state run program, state administered. It's federal money and state money put together. And you call them up, and what you do is you say, hey, I'm paying, you know, Medicare Part B premium, $170, $176, what, this year. And it's tough. There's this program called the Medicare Savings Program. So you call Medicaid and you basically say, will you pay for my Medicare Part B premium? And they'll go through the whole thing and see if you're qualified. And if you are, then they enroll you in Medicaid. And there's several levels of Medicaid. You know, so it depends on what level of Medicaid they put you at. If they put you at, you know, the level where they'll pay for your Part B premium. So that puts an extra $170 or so in your pocket. And if you get higher levels, then there's a lot more benefits. You know, zero if you go to the doctor, zero if you go to the hospital, zero for prescriptions and all that kind of stuff. And then you can get if you're dual eligible, that means you have Medicare and Medicaid. That means you're dual eligible. So for people that are dual eligible, there are other Medicare Advantage plans that have a whole bunch of other benefits in them, cost savings. And so again, you know, if call my Medicare team and they'll go through. Yeah, for people that are dual eligible, then I recommend Medicare Advantage plans. Can't really get a Medicare supplement plan if you're dual eligible anyway. So that's how you do that. Yeah, just call Medicaid and tell them that you, or if you have Medicaid and you're turning 65, or you have been on disability for 2 years. Once you're on disability for 2 years, you're essentially automatically signed up for Medicare. Okay, a lot of people don't realize that. So if you're on Medicaid and you're about to get Medicare, then, you know, tell Medicaid, hey, I'm about to get, you know, Medicare, you know, don't forget to pay my premium. And one of the problems is the Social Security Administration offices throughout the country and the Medicaid offices just don't work well together. So I'm sure some of you on here can attest that you know, they, you know, your Medicaid, the state was supposed to pay for your Medicare Part B premium, and so the two systems, the computer systems, didn't talk to each other, and it was withheld, and then they denied it, and it's just, yeah, that Social Security really needs to come out, and Medicaid offices throughout the country really need to come out with a better system so it talks to each other quicker. Yeah, it's a, yeah, so it's called in Social Security jargon, it's called a welfare accretion. So yeah, welfare accrete. So yeah, you don't need to know that, but all that language is coming back to me. All right, so we've been on here for 1 year. We covered 1 hour, and we've covered a lot. So we talked about the first part talked about the our community core coming up, the getting your Medicare Advantage office. The enrollment period is ending soon. We did receiving benefits while working, so we did pretty good today. All right, I think that'll end it here. And make sure you all like and share and send me an email if you're interested in joining our community volunteer team member. Awesome, save the planet, save the world, save millions of people out there that need help. So email me and we'll get together soon. Y'all take care. Have a beautiful weekend. Bye-bye.